Hello, students. Welcome back to Next Level Academy. Step up your career and your step up your life too. Today, we are going to see an most important and most simple procedure, which is hand hygiene procedure. This hand hygiene procedure, it may look so simple, and but this is very, very important for any skill test. I guess in JIPMER 2022 skill test, this may be asked. So, students, let's go to the slides. First, we have to know there are two types of hand hygiene. The first one is hand rub, and next one is hand wash. What's the difference between hand rub and hand wash? Hand rub is nothing but with any alcohol based solution you use it for hand hygiene. It is called hand rub, which you have to do it for 20 to 30 seconds. Usually, we use sterilium in hospitals and clinics wherever in a hospital setup. So that's called hand rub. And second one is hand wash. Hand wash, it is a another kind of hand hygiene where you use a soap solution. So which you have to do it for 40 to 60 seconds. So today we are going to see hand wash in detail. And another, the most important thing is these hand rub and hand wash which you frequently use in the medical setup. If you see in a surgical setup, especially like in OT, so you do it a surgical hand wash. That is different from hand wash because that is not 40 to 60 seconds. It is around 2 to 5 minutes it takes because you're going to deal with a surgical instrument and surgical procedures. So it has to be most sterile and you're going to deal work within a most sterile part. So let's go to hand. So when shall I perform this hand hygiene? There are 5 moments for hand hygiene, which is published by WHO. The WHO has recommended these 5 moments of hand hygiene. We have to follow this um, in the clinical area. The first is before patient contact. You're going to contact with any patient, or already you have contacted the patient, and you're going to touch the next patient or the neighbor patient. You have to go for the hand hygiene. So usually like hand rubs are available at the patient bedside, you can use that. Unless and until if it is your hand is soiled visibly. Second, before any aseptic technique, aseptic task or a procedure. It's like for an example, like suction or tracheostomy tube change or urinary catheterization. So you can like these are few. So like I've given you example. So these kind of things, you have to use the hand hygiene. And next is after body fluid exposure risk. For an example, like when you're checking the patient's urine output or any secretions or while on suction, okay, the fluid is contacted you, okay, you contact with any fluids or any kind of a blood spill, okay. So you have to go for this hand hygiene is compulsory. And next is after patient contact when you are about to leave the patient, so you have to perform this hand hygiene, at least with the hand rub, as I told you, if it is not visibly soiled. So, in order to prevent the cross infection and also for your safety too. And the fifth one is after contact with the patient's surroundings. It's like oh, you're touching the patient bedside locker or the your after bed making or you're touching the patient's surroundings. So you have to perform this hand hygiene. Okay, I'm ready to hand wash now. Is there any steps available? Yeah, WHO has recommended 7 steps. These steps will take 40 to 60 seconds in the medical setup. If it is in a surgical setup, surgical area like operation theater, it will take 2 to 5 minutes because you're going to deal with the sterile area. Okay, let's go to the procedure. First, wet the hands with the water. Apply enough soap solution all over the hand surfaces. Rub the hands palm to palm. And next, right arm over the left dorsum with fingers interlaced and vice versa. You have to do it with the another hand too. And next, palm to palm with fingers interlaced so that the germs which is lodged between the fingers will be ripped off. And next, look out the fingers opposing to palms with the fingers interlocked, which means the knuckles of the fingers will be, it has to be fingers interlocked. And next, rotation, rubbing of the left thumb over the right palm, vice versa, so that the edge of the index finger and the thumb will be cleaned. And next, rotating or rubbing the fingers so that any germs, any um, soil particles which is lodged in the nails, nail bed, it'll be cleaned. And next, you have to rinse the hands with the water and you have to dry the hand with using a towel. And with using the towel, you have to switch off the tap because your hands are now clean. Now it is also safe from the germs. So these are the steps you have to keep remember, and these are the steps you should not overlap. You should not get confused. And next, thank you for the cooperation, students. And I hope I have explained you clearly and hope you will perform it better. If you like this video, please like, share, and subscribe. Thank you once again. Let's see in the next video.